going on, guys? Attorney Gerald Griggs, a justice fighter here on Justice Media. Wanted to go live. I told you that I'd be going live after the governor released his press conference, and I want to hit on a few points that the governor outlined. The governor has now renewed his emergency declaration of a state of emergency. He actually filed it today after the press conference, and it was ordered actually right before the press conference, the 8th day of April 2020 at 2:41 p.m. And here's what the executive order actually does. And there was a flurry of executive orders, but this is the executive order renewing the public health state of emergency, and it does two things. It says here, ordered that the public health state of emergency declared by executive order on March the 14th, which was set to expire on April the 13th at 11:59 p.m. is renewed for another 30 days. He also indicated that ordered that the public health state of emergency shall terminate May the 13th, 2020 at 11:59 p.m. unless it's renewed by the governor. He also indicated that the shelter in place, which was set to expire on the 13th, is extended until April the 30th. It says here executive orders which was set to expire Monday, April the 13th, 2020 at 11:59 are hereby extended for a period of 17 days and shall expire Thursday, April the 30th, 2020 at 11:59. And what that means is both the response from the state and the executive order are issuing a shelter in place have now been extended because of the conditions on the ground here for the coronavirus. He also issued a couple other executive orders. One was to ensure the safety of employees and residents in nursing homes and long care facilities, outlining procedures for that. That was issued. And then there was a statewide shelter in place dealing with short-term rentals to help stem the tide of individuals going to the beaches. He says here that for the purpose of limiting the spread of COVID-19, no vacation rentals shall occur in the state of Georgia for a period beginning 12 a.m. Thursday, April the 9th, 2020, and extending 21 days till Thursday, April the 30th at 11:59 p.m. And the purpose of this was to prevent people from leaving their locales and going to the beaches and using the summer rentals, which is kind of interesting because the beaches are still open. And he indicated the reason that the beaches were still open was for individuals to still be able to exercise and get fresh air because of all the gyms being closed. I think he should have just closed the state parks and the beaches, but that's what he ordered in his executive order. So again, several executive orders will go into effect and have gone into effect. And so we have the public health state of emergency, which has been extended to April the 30th. The shelter in place, which has been extended to April the 30th. A new guidance and guidelines for nursing home and long care facilities, which I'll go over in a minute, and a suspension of short-term rental properties to stem the tide of people going to the beaches. So let's kind of go over the nursing home long care facilities executive order. And he basically orders here that the term facility has been defined as any immediate care facility, personal care home, or skilled nursing facilities, nursing home, inpatient hospice, assisted living communities, or community integration homes. And he said the facilities shall implement the following protocols: adhere to the guidance of non-critical structure businesses as in the shelter in place order, adhere to the Centers for Disease Control Prevention, Centers for Medicare, Medicaid Services, and the Department of Health's guidelines, adopt an infectious disease transfer communication protocol with local hospitals. A positive COVID-19 test result should not be the sole foundation of a decision to send someone to the hospital for treatment. Any transfer should be based on medical necessity for hospitalization, including the need for respiratory assistance or other emergent medical needs. All testing strategies should be made in consultation with the Georgia Department of Public Health to prohibit all visitors and non-essential personnel except for certain compassionate care situations, to provide in-home dining services if feasible, and to counsel all internal and external group activities as practical. And so it goes into a long list of procedures that they need to follow to make sure that they stem the tide of the spread within the long care facilities and the nursing homes, which we've seen a spike in numerous counties with these care facilities. So the governor went into extensive detail about his new executive orders that are going to go into effect today. Actually, tomorrow they go into effect. And so we need to be aware that that's happening. We also need to be aware that an issue that we've been raising the concern of for a while now is the lack of statistical data based on race for the number of COVID-19 cases in the state. That was addressed by the governor's public health expert, Dr. Toomey. She released the numbers. So the numbers are now on the website, the Georgia Department of Public Health website. And currently, those numbers, again, track the national trend of African Americans being disproportionately affected by coronavirus, even here in the state. Now, they blame that on the number of cases coming out of Dougherty County, coming out of Albany, Georgia. But we all know that there are certain other urban counties that are reporting a large number of coronavirus cases, and we've been reporting that from the very inception of our daily reporting. So let's see if they have the daily reporting numbers up now. And if they don't, I'll give you the numbers from earlier. So they don't have the numbers from 7 o'clock up yet, but for the confirmed cases by race in Georgia, 19% of the confirmed coronavirus cases in Georgia are African Americans. It's actually 19.97%, and 14.74% are white, 1.55% are other, and 63.75% are unknown. And Dr. Toomey kind of talked about that. She said that because of the way the data was being reported, they could not tell the race of these other individuals. But my concern is for the 19.9% and the 14.74%, because you know in the state of Georgia, African Americans only make up 33% of the population. So for 33% of the population to have 19% of the COVID cases, that shows a discrepancy that needs to be studied, and we need more information as to why it seems that it's disproportionately affecting African Americans in this state. So hopefully we'll get more information, and thank you to Pressure from you, the viewers, for getting that and forcing them to have this conversation that we've been talking about for a while. So let's see if they have the updated COVID numbers for Georgia. And they do. So the COVID numbers for April the 8th, 2020 at 6:28 and 21 seconds are now in. And we now have crossed the 10,000 case threshold. We are at 10,189 cases. We have 2,082 individuals that are currently hospitalized. That's 20% of the cases are now hospitalized, and we have a 3.62 mortality rate with 369 individuals having succumbed to the virus. And so when we break it down by county, we can kind of go back to that conversation we were just having a few minutes ago about this being disproportionately affecting African Americans. So in Fulton County has 1,269 cases and 42 deaths. And then Dougherty County has 1,003 cases and 62 deaths. Again, Dougherty County is a vastly majority African American county, and it's running neck and neck with Fulton County. So there has to be something that needs to be addressed in Dougherty County. DeKalb County, 735 cases and 12 deaths. Cobb County, 601 cases and 29 deaths. Gwinnett County, 589 cases and 18 deaths. Clayton County, 296 cases and 11 deaths. Hall County, 234 cases and 0 deaths. Henry County, 217 cases and 3 deaths. Lee County, 213 cases and 14 deaths. Bartow County, 195 cases and 12 deaths. Carroll County, 185 cases and 4 deaths. Sumter County, 181 cases and 5 deaths. Cherokee County, 157 cases and 6 deaths. Chatham County, 124 cases and 4 deaths. Douglas County, 124 cases and 5 deaths. Mitchell County, 116 cases and 11 deaths. And Forsyth County, 101 cases and 2 deaths. And then after that, the counties go from 99 cases all the way down to 1 case. And there are 812 cases that are not assigned to a county and 6 deaths. The commercial lab has now tested 35,980 cases, and the Georgia Public Health Lab has tested 2,807 cases for a grand total of almost 38,000 cases. So in 38,000 cases, we have 10,000 confirmed cases. That's clearly running at a 30% infection rate. Let's go to the numbers by age group. The largest age group is 18 to 59 at 60%. That's holding steady. And after that is 60 plus at 35% and 1% for 17 and under. Females are the most affected sex with 54% female, 44% male. And now the African American statistic has gone up. It's now 20%, 20.53% of the coronavirus cases in the state of Georgia are African American. 15%, 15.25% are white, and 62.77% are unknown. So we need to get this unknown number taken care of, but we also need to focus on the fact that from noon to now, the percentage has gone up for African Americans. African Americans make up 30% of the state, but they make up 20% of the coronavirus cases in this state. Then they break down all the coronavirus deaths by age and county, the oldest being 98, the youngest being 29. We'll see if we have any younger individuals in 29. We've been holding at 29 for quite a while. 30, 31, 36, 97. Yes, 29 is still the youngest coronavirus death in the state. But again, the numbers are disturbing. The fact that we have now cracked 10,000 cases in the state of Georgia, and we've only tested 38,000 individuals. We need to get more in depth into this testing. The governor indicated that there's now a drive-up facility being stood up, so we'll get more information about that where you can have a drive-in test. And as we continue to test and build out, I think these numbers are going to continue to climb, but they're holding steady at 20% hospitalization rate and 3% mortality rate, and between 15 to 20% African Americans infected by the coronavirus here in the state of Georgia. So let's pull out a little and let's look at the national and international picture of the coronavirus currently. So let's see. So the world numbers are 1.5 million coronavirus cases globally. There have been 88,290 deaths. 329,542 individuals have recovered, and we are still going up the curve. The United States continues to lead the world in coronavirus cases with 426,659 cases. That's up 26,000 cases. And now we have pulled almost even with Spain for second place for deaths. We have 14,632 deaths. That's up 1,791. Spain is second in the number of cases, but third in the number of deaths, with 148,222 cases. That's up 6,000 cases from yesterday. And they have 14,792 deaths, which is up 747 deaths. So Spain, we've almost caught Spain. Italy leads the world in the number of deaths with 17,669. Let's pull into the state count. So again, the most affected state currently is New York with 149,000 cases and 6,000, almost 7,000 deaths, 6,900 deaths. New Jersey is next with 47,437 and 3,000 deaths. Michigan is third. Michigan having 20,000 cases and 1,376 deaths. California is next with 18,000 cases and 1,075 deaths, followed by Louisiana, Massachusetts, Pennsylvania, Florida, Illinois, and then Georgia. So Georgia's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We're still number 10 in the number of cases, and we are still number 1, 2, 3, 4, 5, 6, 7, 8. We're number 9 in the number of deaths, being slightly behind Washington, who's cracked the 400 death mark. They had 4 deaths today. We had 21 deaths today. So those are the numbers for coronavirus this evening at 7. Some important things that happened. Again, the governor has extended the shelter in place. He's extended the public health emergency, but he's kept the beaches open. The extension is till April the 30th. So you need to keep that in mind. We are trying to get past the rise, which the curve is supposed to hit. Most deadly day is supposed to be between April the 22nd and April the 27th. So we are still rising, but these numbers are becoming more and more disturbing, particularly in our communities of color, particularly in our minority communities. Particularly, we have to send a special thank you to our essential workers, our public health officials and public health workers that are on the front line, our public safety workers that are on the front line. But we have to hold our elected officials accountable because this was foreseeable. We know this is foreseeable. We need to know the number of beds and the bed capacity. Not telling us we have enough beds. We need to know the numbers because for a long time they were hiding the statistical data. Now we need to know the numbers, where our hospitals are, how many PPEs have been provided, how many face shields have been provided, how many ventilators do we have, and are we prepared for the worst day in this state and to get over the curve and get back to normal? We need to know all that information, and we need to close the beaches. And so we're going to continue to bring you this information on this platform. This is Justice Media. I'm Attorney Gerald Griggs. I will continue to keep you informed about what's happening on the ground in real time here in the state of Georgia and around the world. Thank you for sharing this information. Thank you for listening, and thank you for staying safe. Make sure you follow the Centers for Disease Control's guidelines. Make sure you wash your hands. Make sure if you go outside, you have a face protection, and you know what the governor's shelter in place is. So gloves, face masks, social distancing. Please, if you must go outside, maintain that social distance of 6 feet because we are still rising in the number of cases here in Georgia. I'll continue to bring you this information. I'm Attorney Gerald Griggs. This is Justice Media.